Hi, I'm Dr. Satish Kumar and this is Kaizen Dental. Our motto here is to help dentists succeed. Imagine I give you a call and tell you, let's go out for a meal. Let's try some new place. What would you do? You would go through Zomato. You would check Google reviews and you'll ask your friends. You do so much of planning for a meal of food. Now imagine I tell you, go and find your first job as a dental associate. What do? You go to the dentist nearby. You call a friend and ask them where there is a vacancy. Or you join the clinic where the pay is better. Imagine so much of planning for a meal and no planning for your first job as a dental associate. Once you join as a dental associate, if you're lucky, you will enjoy your experience and your desire to continue with dentistry would increase. However, if you end up in a practice which you do not like, you might end up being frustrated of dentistry. You will feel as if dentistry has no scope whatsoever. You might even have thoughts of quitting dentistry. So don't you think when you take your first job as a dental associate, you need to pay more attention to it? So today, we are going to discuss the points that you need to consider before you take your first job as a dental associate. Stay tuned. Let's dive straight in to the points you need to look into before taking your first job as a dental associate. Point number 1, types of treatment. When we join a clinic as a dental associate, we have a goal in our mind. For some of us, it might be to learn the clinical skill so that we can set up our own private practice. Whereas for others, it might be to use it as a stopgap between BDS and MDS. What if it is a stopgap between BDS and MDS and we plan to do MDS in either orthodontics or pedodontics? If we join a clinic where they do not treat those kind of patients, for example, all the pediatric patients and the orthodontic patients are referred out, does it make sense for us? Of course not. You might not get to treat those patients when you're working as an associate, but observing how the treatment plans are made and how the patients are convinced for those treatments are essentially important. So you need to join a practice where treatments are provided based on what you want to do in the future. Point number 2, types of patients treated. You should always join a practice similar to the one you plan to set up in the long run. Imagine you plan to set up a practice in an area where the elite population stays, and you practice your initial associateship years in a charitable trust. What happens when you make that shift? You will end up with a cultural shock. It is because the type of treatment they expect on their teeth and the way they expect to be treated varies differently depending upon the economic strata, whether they are a financial elite, the middle class, or the financially backward. So understanding this psyche of the patient is extremely important. Imagine you worked at an area where you treated only the elite patients and you did around 3 to 4 patients per day. However, when you put up your own practice, you had to shift to a middle class area where the patient's paying capacity was not as much. So what you had to do, you would have to increase the number of patients you treat per day. But Since you are used to working slow and steadily, it becomes very difficult to increase your speed. Therefore, having a rough idea as to what kind of practice you want to put in the future, you need to select the similar kind of practice to work as a dental associate. Third point you need to consider is practice owner or head dentist. You need to understand, once you're out of college, there are a lot of things you need to learn. Who are you going to learn it from? It is under whose mentorship you're going to work. So the knowledge and experience of the practice owner whom you're working for is very important. You need to be able to pick up good clinical skills and understanding when it comes to diagnosis and treatment planning. Having these good habits from the start helps you grow in dentistry. We have seen a trend of a lot of newly passed out dentists putting multiple clinics. What they do is they end up hiring other freshly passed out dentists to run the show. The concept is the more number of patients you treat, automatically your work tends to improve. But that is not true. You need someone to assess your work initially. Otherwise, all those bad habits tends to seep into your practice. And later, it becomes extremely difficult to break out of those bad habits. So having someone to guide you is very important. Of course, there are exceptions. There are few freshly passed out dentists who I've met who are extremely knowledgeable and know their clinical dentistry very well. So it is important before you join a practice to know that you will get to learn from the practice owner or the lead dentist out there how to go about treating patients. The fourth point you need to consider is the clinical team. We here at Kaizen Dental believe that dentistry is not a single person's job. To provide great dentistry, you need an entire team. From someone who is extremely competent, the practice owner or the lead clinician, to amazing dental associates, to a very good lab technician, to good assistants. All this is required to provide the best and satisfactory treatment to your patients. So when you join a practice where there are a lot of senior associates and at times assistants who have been in dentistry for decades, it acts as an added advantage. So look for practices where you can not just learn from the practice owner, but from the entire team around it. Fifth point you need to consider is work exposure. There is an obvious difference between working in a college and working in a private practice. We understand the importance of having an observation phase where you see how the systems of the clinic run, how the diagnosis, treatment planning is done, how the patients are treated. But after a given period of time, you need to be able to work on patients. There has to be a slow and steady increase of your clinical workload. You should not just be stuck with scalings and class 1 restorations. There has to be a growth to class 2 restorations, anterior root canals, then slowly shifting into posterior root canals, extractions of mobile teeth to slowly extractions of third molars. This continuous growth in your clinical skill is extremely essential. So you need to join a practice where you can hone your skills and slowly and steadily grow as a clinical dentist. The sixth point you need to consider is salary. Most of your associates would be thinking, why did I put such an important thing at the bottom of the list? I understand in today's day and age, finances is very important. You have a life to live outside dentistry, so you need enough income to spend. It becomes embarrassing after finishing your dentistry to go and ask your parents for money for spending. So of course, you need to earn a reasonable salary. But that is not the only thing you need to consider. In your initial phase, you need to work to learn, not work to earn. Because if you focus only on money, you will not be able to improve your clinical skills, which will take you to the next level of income. If you work as an associate, where you do only scalings, but you earn a huge salary. Later, after a few years, when you want to take the next leap, do you think any dentist would hire you, pay you greater amount of salary? Because you have not improved your clinical skills. Could you go and set up your own practice? Because you're not confident about yourself. So focusing on the quality of work you get to do rather than income should be your initial priority. So the 6 points which we feel you need to consider before getting a job as a dental associate are: number 1, treatments given in the practice. Number 2, types of patients treated. Number 3, practice owner. Number 4, the clinical team. Number 5, the work exposure. And number 6, the salary. If you like this video, click the like button below, subscribe to our channel and click the bell icon so that whenever we post a new video, you would come to know about it. Do not forget to share this video with your friends so that they also can learn from it. The question for today is, which out of these 6 points you think is the most important that we usually tend to miss out on? Why are we asking you to answer these questions is so that there is a discussion and each one can come to know more about how to go about surviving and succeeding in dentistry. I'm Dr. Satish Kumar. This is Kaizen Dental, and our motto here is to help dentists succeed. Thank you.